Let's dive into the basics of a peripheral blood smear, one of the foundational tools in hematology. It's an essential skill for any medical student, providing a window into the health of a patient's blood cells. First things first, what exactly is a peripheral blood smear? It's a laboratory test where a drop of blood is spread thinly onto a glass slide, stained, and then examined under a microscope. This allows us to look at the size, shape, and number of different blood cells present, and it's pivotal in diagnosing various hematological conditions. Now let's talk about the steps. After obtaining a blood sample, usually through a finger prick or a venous draw, you place a small drop onto one end of a slide. Using another slide at an angle, you spread the drop across the surface, creating a feathered edge. This edge is crucial because it's where the cells are sufficiently spread out to be examined individually. Next up is staining. Typically, the right Gemsa stain is used. This stain helps differentiate the components of the blood, making it easier to identify different cell types. Once stained, the slide is rinsed and dried, ready for microscopic examination. Under the microscope, you'll be looking at three main types of cells: red blood cells, white blood cells, and platelets. Red blood cells, or erythrocytes, should appear uniform and biconcave. Any variation in size and shape could indicate conditions like anemia or spherocytosis. White blood cells, or leukocytes, are categorized into five main types: neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Each type has unique characteristics, and their relative proportion can give clues about infections, inflammations, or leukemias. Lastly, platelet or thrombocytes are small fragments crucial for clotting. Their number and appearance can point towards disorders like thrombocytopenia or thrombocytosis. A well-prepared peripheral blood smear can reveal a lot about a patient's health. It's not just about recognizing cell types, it's about understanding what these variations mean in a clinical context. This skill will not only help you in diagnosing but also in understanding the patient's overall health. So, keep practicing those smears. And remember, every slide tells a story. Thanks for watching and keep learning. Keep